Now let us start with the basic concepts about the giants part 2. The second major group of giants is synovial giants. The articular surfaces in these giants are reciprocally adjusted and covered by hyaline cartilage. The bones forming such joints are bonded by fibrous joint capsule, which is reinforced by accessory ligaments. A joint cavity is always present, which is lined with synovial membrane, contains synovial fluid, and may be partially or completely divided by an articular disc made up of fibrocartilage. Some degree of movement is always possible at these joints. These giants are classified according to different criteria. Number one, according to complexity of form and structure. Number two, according to shape of articular surfaces. And number three, according to degree of freedom of movements. First classification according to complexity of form and structure. This classification depends upon number one, number of bones involved, and number two, presence of intra-articular disc or meniscus. According to this criteria, the synovial giants are divided into three categories. Number one, simple giants where only two bones are involved. Simple giants are of two varieties. Number one, homomorphic giants. The bones involved are similar in shape and size. And the second variety is heteromorphic giants where the bones involved are dissimilar in shape and size. Second group is compound giants where more than two bones are involved. And when there is an intracapsular disc or meniscus between the bones, then the giants are named as complex giants. Second classification of synovial giants is according to shape of the articular surfaces. This classification is also named as general classification. It depends upon shape of the articular surfaces. And types are number one, plane giants. The opposing articular surfaces are almost flat and the only gliding movements are possible. Second group is hinge giants, in which cylindrical convexity fits into a corresponding concavity in the shape of a hinge of the door. Number three, pivot giants, an axial shaped bone that is pivot lies inside an osteoligaments ring. There are two types. Number one, in which pivot rotates inside a stationary ring. And the second variety is that ring rotates around a stationary pivot. Fourth group are the condylar giants, in which condyle or knuckle-shaped structure, which is all in an almost spherical in shape, fits into a concave, shallow spherical fossa. Number fifth, bicondylar giants. Two distinct spherical surfaces fits into two distinct shallow concave fossae. These could be again of two types. In first one, both the giants are present within a single capsule, where in the second variety, two separate capsules are present as covering the two separate giants. Sixth group is ellipsoid joints, in which an oval articular surface fits into an elliptical concave surface. Seventh, saddle or cellar joints, reciprocally concavo-convex surfaces fit into one another. In eighth group, these spheroidal or ball and socket joints, a more or less extensive sphere fits into a rounded cup-like cavity in the other bone. Examples according to general classification. Number one, gliding joints. Example, intercarpal joints. Number two, hinge joints. Example, elbow joint. Number three, pivot joint. Either the axial rotate or the ring rotates. First variety is exemplified by superior radioulnar joint, whereas the second variety is exemplified by atlantoaxial joint. Number four, condylite joints. Examples are metacarpophalangeal joints. Number five, bicondylar joints. Two condylar joints either within a single capsule or two separate capsules. Is first example is knee joint, and for the second is temporomandibular joints. Sixth type is ellipsoid joints. Example is wrist joint. Seventh are the saddle joints, indicated by first carpo-metacarpal joint. Eighth are the ball and socket joints. Example is shoulder joint. Third classification of synovial joints according to degree of freedom of movements or axis of the movements. This classification depends upon number of axes around which movements are permissible. One must know that basically there are three mutually perpendicular axes, that is vertical, transverse and anteroposterior, around which movement can occur. Similarly, there are three mutually perpendicular planes, that is sagittal, coronal or horizontal, along which movement can take place. Keeping this fact in mind, the joints are classified into three groups. Number one, uniaxial joint, where movement around only one axis is permissible. And this uniaxial joints are further divided into hinge joints, pivot joints, which are of two types. Either the pivot rotates inside the ring or ring rotates around the pivot. Third variety, bicondylar joints, which are again of two types. Two joints having a single capsule and two joints having two separate joint capsules. Second group comprises the biaxial joints, where movement can take place around two axes. And in this group, there are ellipsoid joints, saddle joints, and condylar joints. Third group is polyaxial or multiaxial joints, where movements around all the three axes are permissible. Now let us have the examples of the joints according to degree of freedom of movement. First, the uniaxial joints. This group have got three varieties. Number one, hinge joints. Example is elbow joint. Number Second variety is pivot joints, have got two types. Pivot rotates inside the ring. Example is proximal radio-ulnar joint. Second one is ring rotates around the pivot, and example is atlantoaxial joint. Third variety is bicondylar joints. This variety has again two types. Number one, joints with a single capsule, example knee joint. Number second, joints with two separate capsules. Example is temporomandibular joint. Second group joints are the basic biaxial joints. This is divided into three varieties. Number one, ellipsoid joint, example wrist joint. Number two, saddle joints, example first carpo-metacarpal joint. Number three, condylar joints, examples metacarpophalangeal joints. Third group is polyaxial or multiaxial joints. And the best examples are shoulder joint and the hip joints. Intervertebral joint complex and clinical anatomy. There are three varieties of joints between two vertebrae. Number one, syndesmosis, that is fibrous joint present between the laminae. Second type, symphysis, the secondary cartilaginous joints is present between the bodies. And number three, the synovial joints present between the articular facets of the upper and lower vertebrae. As regard the clinical anatomy, spinal disc herniation is the very frequent ailment seen nowadays. It is asymmetrical compression of intervertebral disc which leads to rupture of the disc and a sac-like herniation of its soft contents, that is nucleus pulposus, herniates and compresses adjacent nerve roots, causing back pain and sciatica. This diagram depicts mobility of a particular joint versus stability of that very joint. If we critically analyze this diagram, we come to the conclusion that the most immovable joints, such as sutures, are the most stable joints, whereas on the other hand, the most mobile joints, such as shoulder joint, is a very unstable joint. Comments and suggestions will be welcomed. Thank you for listening and watching.